Other significant difference is the trial built-in crossover. So if you were on the control arm and had progression of disease, you were offered, enabled, provided Sacituzumab in that crossover. And the primary endpoint is powered exclusively for progression-free survival. So ASCENT-03 has many similarities to TROPION-Breast02. It is a first-line trial for patients with metastatic triple-negative breast cancer who were not candidates for checkpoint inhibitor. The definition there is a little bit different. So patients either needed to have a PD-L1 negative tumor or a contraindication to receiving a checkpoint inhibitor or potentially had previously received it. This trial did have a bit of a cap on disease-free interval. So you needed to have at least 6 months of therapy, 6 months of distance from your early stage therapy before coming on study. And the trial capped those with less than 12-month disease-free interval at 20% of the study population.
So sort of weeding out that bad group
that
of tumor.
Really early progressor,
Yeah.
exactly. This study randomized patients to Sacituzumab govitecan as a single agent or standard of care chemotherapy. Here the choices are a little bit different, taxane again, or the combination of gemcitabine with carboplatin. Other significant difference is the trial built-in crossover. So if you were on the control arm and had progression of disease, you were offered, enabled, provided Sacituzumab in that crossover. And the primary endpoint is powered exclusively for progression-free survival. Overall survival is a secondary endpoint.
Okay. And you know, one of the things, coming back to TROPION-02, is the chemotherapy choices. So between the two trials, obviously gem-carbo was one thing, or you got a combo option in ASCENT, not in TROPION, and capecitabine is in one versus the other. Do you think those chemotherapy choices may have driven any of the outcomes, which we'll come to in a minute?
I think it's a great question. You know, I don't think we've seen that the combination of gem-carbo is going to impact overall survival, so it may explain some differences we might see in how the control arm performs in terms of response rates in these trials. But I think there's some confounding here because that disease-free interval matters, and we need to think about what those patients saw in the early stage setting, and that would drive what they then were getting as the investigator choice on the control arm if they were a rapid progressor, for example. So even in TROPION-Breast02, the vast majority of patients were getting a taxane. Almost 80% of folks saw a taxane as the control arm therapy. In ASCENT-03, it was a bit more of a sort of 40-60 split between taxane or the gem-carbo combination. So I don't know if that is explaining some of the differences that we see in the trial.
Might have explained response rate, perhaps.
Exactly.
So tell us a little bit about the high-level results again from the ASCENT trial.
Yeah, so a great positive trial, wonderful to see for our patients that, again, progression-free survival is the primary endpoint, and that did favor Sacituzumab over standard of care chemotherapy. Numerically, obviously, the difference is a little bit smaller. The median PFS with Sacituzumab was about 9 months and change. The control arm did a bit better than what was seen in TROPION-Breast02 at about 6 months and change. And so a significant, both clinically significant and statistically significant difference was seen there.
So do you think weeding out, as they did in this trial, patients who didn't have rapid progression may have explained the smaller delta?
Perhaps. I mean, I think it might explain why we have just a better performance in the control arm, if you will, and then as, you know, there's just that slightly less performance in the SASI arm.